What are pulmonary TB symptoms versus flu? Imagine trying to figure out if you have a lingering cough from a cold or something more serious like tuberculosis. Both can cause cough and fatigue, but they are very different illnesses. Pulmonary tuberculosis is a bacterial infection that affects the lungs and develops slowly over weeks. Its symptoms include a cough that lasts 3 weeks or longer, often producing blood or thick sputum. People may also experience chest pain, weakness, and fatigue. Weight loss and loss of appetite are common, along with chills, fever, and night sweats. These symptoms tend to worsen gradually, indicating an active infection that needs medical attention. In contrast, the flu is caused by a virus and hits quickly. Symptoms usually appear suddenly and include fever, chills, muscle aches, and fatigue. You might also have a sore throat, runny or stuffy nose, and headache. The flu generally lasts about a week or two, and most people recover without complications. The cough associated with the flu is usually dry and short-lived, unlike the cough in tuberculosis, which can be persistent and sometimes produce blood. One key difference is how symptoms develop. Tuberculosis symptoms tend to build up slowly and worsen over time, often taking weeks to become noticeable. The cough lasts longer and may be more severe, especially if the disease progresses. On the other hand, flu symptoms come on suddenly, peak quickly, and then improve within a couple of weeks. Another important point is weight loss and night sweats, which are common in tuberculosis but rarely seen with the flu. If someone has a cough that lasts more than 3 weeks, along with weight loss or coughing up blood, it's important to see a healthcare professional for testing. Because tuberculosis is bacterial, it requires specific antibiotics for treatment, while the flu is viral and usually resolves on its own or with antiviral medications if caught early. Sometimes, a person can have both illnesses at once, which can make diagnosis more complicated. An influenza infection can also weaken the immune system, potentially worsening tuberculosis or increasing the risk of developing active disease from a latent infection. That's why accurate diagnosis through medical testing is essential. If you experience persistent cough, unexplained weight loss, night sweats, or blood in your sputum, seek medical advice promptly. Remember, early detection and proper treatment are vital to managing tuberculosis and preventing its spread. Always consult healthcare professionals for personalized diagnosis and care.